Hi, my name is Amit Munjal, and I'm the founder and CEO of Dr. Insta. We are a virtual healthcare company based out of Gurgaon and Los Angeles. I'm spending more of my time in Gurgaon than anywhere else. See, what is happening is many a times we all are in a state of inertia that oh, we have this small issue that would get resolved automatically, so let's let it hang there and get it resolved by itself. Or we go to a chemist shop where we speak with someone who is not even a pharmacist and is just the attendant, and we let this person experiment with us. So virtual healthcare solves both the problems of procrastination and the second problem of self-medication that we are seeing in Indian market. With virtual healthcare, you can consult a doctor any time of the day or night, no matter where you are from. So according to your convenience, and get the best possible medical advice from a subject matter expert, in this case a doctor, and then start your treatment, then experimenting with your own health. Like for example, many state governments in the country did this campaign saying that in a dengue season, if you suspect that you could have a dengue, please don't self-medicate, because you could make a bad situation worse by doing a self-medication. So rather than doing a self-medication, go consult a doctor. So through these channels, virtual healthcare provides you instant connection to the doctor through video or phone as well as chat, and as a result of which you don't have to waste 3 to 4 hours of your time or stay in the state of inertia that, oh, I'll go to the doctor tomorrow or day after because I have a busy packed schedule today. Virtual healthcare market opportunity in India is huge. 70% of outpatient department consultations could very well be replaced through virtual healthcare, which means that all the patients who have to travel from their home or office to the clinic or hospital, 70% of those patients don't have to waste their time doing it, and they could very well get their issues resolved through virtual healthcare. So the impact on the planet, impact on the environment is also huge. In terms of market sizing, it's a $25 billion market in India and an equally big market in other developing countries, whether they are in Southeast Asia, Middle East, or African region. So in totality, $50 billion market out there yet to be grabbed, because we have seen players emerging in US market or European market, but rest of the world is a virgin territory for virtual healthcare. In the first phase, we were expanding in India. We are already a pan-India company, so you can have a consultation through Dr. Insta no matter where you are in the country. We are anywhere you have a good internet connection or a good phone connection. You can get your consultation through video. You can get your consultation through phone. An electronic prescription gets generated in the back end and gets sent to you inside the Dr. Insta app or through the website of Dr. Insta and sent to you in your private email box, as well as inside your profile at the app. We are available not just through web, but also through Android and iOS. So if you have an Android phone or an iOS phone, or let's say you don't even have a smartphone and just have a computer or a tablet, you can access the doctors of Dr. Insta from anywhere in the country. Competitive differentiation is that it's a white space in India. This problem is yet to be solved in India for Indians. So we don't see a whole lot of entrenched players in the market out here. To address the second part of your question, what differentiates Dr. Insta? Then the differentiating factor is one, Dr. Insta is a curated place. So all our doctors are placed on the platform once they go through rigorous selection, screening, and training process. So we are not aiming to develop Dr. Insta to be a electronic yellow page for or directory for the doctors. We thoroughly vet them and then place them on the platform. Every doctor is expected to give 30 consultations or so in a given day. So as the demand increases from the customers or the patients for Dr. Insta, we would put more and more doctors on the supply side to provide consultations to the patients. There are certain practice areas that we are targeting in the first wave. So these practice areas are general medicine, dermatology, sexology, psychology, and pediatrics, which is child health, as well as diet and nutrition. So the way Dr. Insta is structured is we are targeting preventive care through our health coaches, and then we are in curative care where we have two subcategories. One is physical health and the other one is mental health. Within physical and mental health, there is another segregation between adult health and child health. So that's how you look at the service offering of Dr. Insta. We have a three-pronged business model. One is B2C, business to consumer, where anyone in the country can come on site or download the app and do the consultation with the best and the brightest of the doctors. The second one is B2B2C, so business to consumer, whereby the major companies out here, the American Express, the Citibanks or Bank of America or ICICI or Wipro, could offer this platform to their employees, who in turn can get their medical consultations as well as the medical consultations of their dependents or relatives, whether it is aging parents or very young dependent children, through the platform. It's a great productivity enhancement lever for the employers. Why? Because if I am working with, call it Infosys, and I take 3 to 4 hours off to get my medical consultation done, then who suffers along with me? My employer. And if I'm running my own business, still if I have to take 3 to 4 hours off to get a consultation, who suffers along with me? My business. So if employers and business suffer, the whole nation suffers. So through virtual medicine, Dr. Insta is making a small attempt at making a nation more productive, more efficient, so that we could leapfrog from being termed as a developing country to a developed country in the next 10, 20, 30 years. We have been funded through Bramex Ventures and a couple of angel investors. We raised around $500,000 a few months back, and we are reasonably well funded to keep on plugging away on our path to making Dr. Insta a more established player in the country. My expansion plans are multi-pronged. One is when I was talking about B2C and B2B2C, we have another tier called B2G, business to government. So we are reaching out to state governments and central government of the country, saying that you should offer Dr. Insta to your employees. So this way your employees can save time, serve the nation better, and guess what? You would also get analytics. So if I am the Union Health Minister of India, I want to know what are the top 10 medical problems in the country. What are the issues such that I can develop and devise my welfare packages for the overall benefit of the employees. So similarly, if I'm running a company, I want to know what are the top 10 or top 5 medical problems with my workforce, so that I could develop a more productive, more efficient, longer lasting and happier workforce. And right now, no company has those analytics, but as they enroll themselves through Dr. Insta, they would get those analytics from our platform. The third thing is PPP, public-private partnership. So Dr. Insta has a unique program called Dr. Insta Inclusion, using which we are going to the villages. So in villages, government is setting up e-kiosks, which are catering to every possible need of the villagers who are not digitally enabled. By digitally enabled, I mean they don't have a smartphone, they don't have a credit card or debit card, and they don't even have probably an email address. So how do you provide the benefits of e-commerce to these people in the villages? These villages are in Jhansi and Hasi and Itarsi of the country. So these e-kiosks are set up to provide these benefits to the villagers in the country. What we are doing is we are tying up with these e-kiosks so that the average villager who doesn't even have access to a good quality MBBS doctor even in the civil hospitals or the clinics in those villages can get access to telemedicine and video medicine and get their problem resolved, because right now in the absence of a primary caregivers, they are dependent upon quacks or fly-by-night operators which are playing with their health. So using this telemedicine and video medicine outreach effort, we are solving that problem at the grassroots level of the country.